For the Introduction to Epidemiology class and the modules on measures of disease frequency, this is the first lecture segment. So in this segment, we'll be talking about definitions and assumptions in epidemiology, and specifically definitions of epidemiology. But first, the overall objectives for this module are that students will be able to discuss key assumptions within definitions of epidemiology. They'll be able to apply correct numerators and denominators for incidence and prevalence, be able to distinguish between disease incidence expressed as a risk versus a rate, and be able to recognize the importance of the treatment of time in measuring disease. So starting with definitions of epidemiology. This is some rather wordy text, but I think it provides some key aspects of the way we think about epidemiology even today, even though this is written in 1944 by an individual named John Gordon, and who was giving his perspective on epidemiology and what it is and what it means and what the assumptions are. So he says that epidemiology has to do with the physiological state of communities and with the diseases of man as they affect populations of people. So this is a key assumption of epidemiology, that we're interested in diseases, but we're interested in them at the population level, not the individual patient or not the laboratory model of disease. He goes on to say that its distinguishing characteristics are the study of disease as it occurs under natural conditions and by a unit of observation, which is the whole population of people, animals, or arthropods. So two interesting things there that I want us to think about is where he says it occurs under natural conditions. And I think he's just contrasting that to experimental. So epidemiology usually does not deal in interventions. We are randomizing these people to take this pill and these people to not take this pill. That's not what we're doing. That would not be the natural condition. Epidemiology is just observing what's happening in the natural condition. And then he goes on to say the unit of observation being the whole population. But then he further says it's a population of people, animals, or arthropods. So animals, I can get. Veterinarians, in fact, there are some very fine epidemiologists among veterinarians. They're interested in the whole herd, the whole population, a lot of infectious disease and communicable disease issues in veterinary medicine. And so people or animals, either one you can apply epidemiology. Arthropods threw me for a minute, but I think at the time that he's writing this, a huge thing in epidemiology was some diseases that can be transmitted, or traditionally epidemiology, diseases that can be transmitted by insect vectors. So your fleas, your mosquitoes, your ticks, and still today we have those problems. So I think that's why he throws arthropods in there. Okay, next paragraph starts, recognition of multiple factors in causation is inherent to an ecological interpretation of mass disease. So this idea of multiple factors is absolutely critical in thinking about epidemiology and how we approach epidemiology. Okay, so then towards the bottom of the same slide, the concept of causation is thus brought into line with modern medical attitudes and classification of disease, which is according to agent. So this concept of classification of disease becomes really important in epidemiology because what are you measuring? What are you studying? How do you classify and organize your thoughts about your disease that you're studying? He goes on to say, mass disease is thus looked upon as the interaction of a triad, the members of which are a host, an agent of disease, and lastly, the intricate complex of environment. So host, agent, and environment are often quoted in public health textbooks as being three key aspects, and this is one of the earliest uses of that phrases, so I thought I was obligated to show this to you in our definitions of epidemiology. I would never ask you about that triad on a test, but you may see it in textbooks, in other textbooks. Okay, so a different definition. So this is the textbook for this course series by Weiss and Kepsel. In Chapter 2, they say that epidemiology concerns describing and understanding patterns of disease occurrence in human populations with the ultimate goal of preventing diseases. A very nice definition, again emphasizing the population, the study of the population, and also what is our goal? Why do we want to do epidemiology? Ultimately, we want to prevent disease. And that ties in with our whole emphasis, as we had in the first module of this course, the thinking about cause and effect and how we can infer causation from our studies, because we have this goal of preventing So we want to understand causation in order to prevent. So a definition that I actually like is from a textbook which may no longer be in print by Hennekens and Buring from 1987. But here's their phrase, that epidemiology is the study of the distribution and determinants of disease frequency in human populations. I like this definition because, first of all, it's alliterative, so you can remember it, distribution and determinants of disease. And also because we can go from this short phrase into some specific assumptions that underlie all of our epidemiology thinking. So distribution means the patterns of disease in the population, and it may be the distribution according to the characteristics of the individuals and the characteristics of their environment. So whatever this disease is, are we seeing more of it in the older population or more of it in the younger population? Are we seeing more of this disease in people who live in crowded cities or in the countryside? Are we seeing more of this disease in one situation compared to another situation? So the distribution of disease according to the characteristics. Now, the assumption here is that disease does not occur at random, but that the patterns caused by a lack of randomness can inform us about determinants of disease. So we can use statistics, we can use data gathering and statistics, see what variation seems to be at random, and see what variation is not at random, and that latter part can inform us about the determinants of disease. So by determinants, in the simplest sense, we mean the causes of disease. What determines whether you have a disease? Also in clinical epidemiology, what determines whether you recover from the disease? What determines whether this treatment is effective for you? We might also be interested in the relations or associations between the characteristics of people and their environment, that is to say their exposures, and disease. So there may be aspects of who is getting more of a certain disease and who is not that we might not think of as literal causes, but there are things that are related to the causes and thus maybe merit study because they are part of the pattern and part of determining the causes of this disease. So a key assumption, as we saw in the quote from Gordon, is that disease is multifactorial and there will be a number of determinants. Okay, disease itself. So a certain number of people taking this course are physicians, and you're probably sitting there thinking, you don't have to define disease for us. Okay, but we need to define what we're trying to study in epidemiology. So in all these phrases where we say the determinants of disease, the incidence of disease, and so on, what actually do we mean? So in epidemiology, this may be referring to any health-related state or event. Or in other words, you can do an epidemiology study of disease itself, lung cancer, flu, high blood pressure, autism. And we might think about disease as either states, so that first group, you can have lung cancer, you can have flu, you can have high blood pressure. Over a period of time, that disease state is present in that individual. There might also be disease events, which are things that would occur with a really specific time associated with them. So disease events might be injuries, spontaneous abortion, myocardial infarction. And we might also use epidemiology to study outcomes among individuals who are diseased. So cures or complications or deaths or progression of disease. So when we say we're studying disease, very often in the classic public health sense, they mean the causes of a new case of disease, of someone getting sick or acquiring a disease. But in the broader sense, and especially in the clinical epidemiology sense, we might be studying a number of aspects of disease, including people who already have disease and how that is progressing or how that is cured in those patients. So the outcome of interest in epidemiologic study, we can also use these epidemiologic study to study certain other things, or they commonly are used to study certain other things. So we might study a factor that influences disease. So if it's known that certain nutrients are helpful in preventing disease, or that maintaining a low cholesterol level or certain types of cholesterol will protect us from heart disease, if we already know something about that, we may choose sort of a biological endpoint that's not disease itself, but it's one of these factors that influence disease that might be more measurable in the short term. We might also study a behavior that influences disease. It's been well known for a number of decades, as we talked about in our first module, that cigarette smoking causes lung cancer, that cigarette smoking is associated with a number of other adverse health events. So now that we know that, is the problem solved? Well, not completely. It turns out that smoking is addictive. So what are the factors that can help people quit smoking? There's an entire literature about smoking cessation. There are a certain number of randomized trials and intervention studies, but we might also use epidemiologic methods to study what populations are succeeding better than others at smoking cessation. Another example might be mammography or other screening tests that are used to prevent the ultimate worst outcomes of a disease. So if we know from randomized trials that mammography can lead to fewer deaths from breast cancer, okay, we know that, but now how do you get people to comply and participate in the recommended screenings? Again, there are randomized trials of mammograms, but there's a lot of observational studies of participation in mammography and what are the factors related to carrying that out. And the same thing would go for other screening and prevention behaviors. A lot of observational methods are used in terms of what things are supporting or what things are barriers to people participating in those health screenings or early diagnosis. Okay, so two words that I will use repeatedly are going to be exposure and outcome. So let me just take a moment to tell you really specifically what I mean when I say exposure and outcome. So pretty much every variable measured in an epidemiologic study is, to me, either an exposure or an outcome. So an exposure is going to be the hypothesized determinant or cause, the independent variable, if you like to think about it that way. So in clinical epidemiology, though, what I would call the exposure is actually a treatment. So if we're going to do an observational study of people who have a certain condition and which ones are going to do better in the long run and be cured and which ones are not, how those people are treated, what's the various types of treatments that are offered to them, that in the epidemiologic sense is also an exposure. But more traditionally, the exposure might be what was the source of drinking water, what occupation did people work in, did they smoke, all of those things that might be considered risk factors or causes of disease in our data set, we would refer to as the exposures. And then we are going to have the outcome or the disease endpoint, the dependent variable. So I'm going to use those words exposure and outcome as sort of the putative cause and the effect.